really excited here to be able to talk to you about recurrent respiratory papillomatosis, or RRP, on behalf of Precigen and all patients who are affected with this. RRP is a chronic viral infection caused by the HPV virus type 6 or 11. It affects the vocal cords. So it causes voice changes when papillomas grow on the vocal cords. Historically, the only way to treat this was with surgery. So we would take patients to the operating room and with lasers or other instruments, remove the papilloma. But because we haven't addressed the underlying infection, the papilloma would recur. So patients are in an unending cycle of recurrence, surgery, recurrence, and surgery, impacting their voice and breathing. Well, surgery takes its toll, as you can imagine, in every aspect of your life, and not only the vocal cords, which can build up scar tissue as a result of all these interventions. So we really want there to be something non-surgical to address the underlying cause. And Pabzimios is a new HPV-specific immunotherapy that's designed to boost immune system, direct your immune system to actually address the underlying chronic infection. So this is a series of shots which mount an immune response, analogous to giving a flu vaccine or a COVID vaccine, where you get a little bit of a flu-like type symptoms, but then it's generating the immune cells that can actually clear the underlying HPV infection.
Well, living with RRP, for me as a preacher, my voice is everything. It was like a living nightmare until I received knowledge pertaining to RRP, and that through surgery, my voice could return. But then because it's reoccurring, my life was based on a doctor visit, observation, surgery, and it was continuous. And while I was thankful, but when I heard about the clinical trial, I was overwhelmed and I was hopeful and optimistic. And when the FDA approved the first non-surgical drug, I was elated, and I am thankful as a recipient to be able to be a witness, and I am overjoyed, and I hope that others can be overwhelmed knowing that they no longer have to go through repeated surgery. My advice is that they go to president.com to receive information, talk with their ENT, allow this to be known, because in the beginning, I had no knowledge. I thought I was just hoarse and that I could just rest my voice, but days turned to weeks, weeks turned to months, and even going to the ENT, it was 7 months later, and then the repeated surgery. So I'm hopeful. I am hopeful. The shot was just like getting a COVID shot or a shot for the flu. It lasts 24 hours. But the benefits, oh my God, I am still excited, is out of this world. So if anybody's dealing with RRP, please contact your ENT. I go to president.com to get more information so that you don't have to continue to deal with the repeated surgery.
Well, exactly as said by Dr. Smalls, better than I could say it. The toll of surgeries is immense. It damages the vocal cords. It affects your life in every possible way. And now that there's actually something that can really try to address the root cause, we want all patients to be aware and seek this sort of new treatment, because it can be absolutely life-changing.
Yes.